This video is about nappy rash, a really common problem in young babies, a red, irritated area in the nappy region. And there are 6 causes for this. In order of commonness, number 1, by far and away the commonest, is contact with urine or wee, which has got substances in it which can irritate the skin. And whilst it's very common, it's not a sign of itself of neglect or poor hygiene or poor care. Certainly if you do have a child who's been neglected with poor care, it can be really much worse, much more florid. Secondly, what we doctors call candidiasis, what you might call thrush, a fungal infection, often causes little white spots, or what we call satellites, little red spots that are removed from the general red area. And number 3, medical term, contact dermatitis. That means an allergic reaction to something the infant's nappy area is in contact with. Now, when parents used to use a lot of washable terry nappies, some of the detergent might be left in the nappy, and the infant would then have an allergic reaction to that. And the way to avoid that, if you do use terry nappies, and they're probably on the increase as we try to move away from our throwaway society, then use a non-biological washing powder. Number 4 is it may be part of a wider rash, typically baby eczema. Baby eczema, very common on the cheeks, forehead, sometimes the fronts of the elbows or backs of the knees, and it can occur in the nappy area, particularly if an infant's changed from breastfed to being formula fed. Infant formulas, bottle milk is made from cow's milk, and some infants are allergic to cow's milk protein, and when they start to change over from breastfeeding to formula feeding, they may get a rash around their bottom that eventually fills up the whole nappy area. Fifthly, any of these can get infected with bacteria, bugs, germs, so-called secondary bacterial infection, and that will need treatment with antibiotics. And finally, the most difficult one, technical term for the 6th one, is seborrheic dermatitis. It's actually quite similar in many ways to cradle cap. It develops after a few months. Its clue to it is it's not distressing, unlike the other ones. And I'll say more about that in a moment. Now, how to avoid it? Some simple measures. Number 1, most importantly, change your infant's nappy frequently and at the very first whiff of wee or poo. Don't leave them in the nappy. Sometimes it's unavoidable. 2, absolutely avoid plastic pants or overpants. They keep humidity, warmth, moisture in, and the bacteria on the skin that act on wee, urine, to make the chemicals that irritate the skin, they just love that hot, warm environment, as do the fungi, the little yeasts that cause thrush. Thirdly, whenever possible, expose your baby to the air. Leave them lying on a changing mat on the nappy rather than in the nappy for some time whenever possible. And finally, 4thly, after every change, after you've cleaned them, washed them with soap and water or with wet wipes, and you've made sure the skin is completely dry, apply very liberally what's called a barrier cream or a barrier ointment, which stops these chemicals, even they're in the nappy, being in contact with the infant's skin. So you can use E45 cream from your local chemist. My favourite for my own children, zinc and castor oil. Sold under the trade name in the UK, Pseudocreme also contains zinc as a protective, or Vaseline. And you apply these very, very liberally after cleaning and drying the infant. There's absolutely no possible side effects to any of these. You cannot put too much on, so put plenty on after every nappy change. And finally, if nappy rash does occur despite these things, what do you do? Well, for the commonest type, contact with wee or feces, stool, poo, you follow the advice I've just given you. But if it's not improving, then the other 5 causes might need specific treatment. So for example, candida thrush needs an antifungal ointment. Ointments are better than creams because they stay on the nappy area. If it's cow's milk intolerance or allergy, then you would need expert advice about avoiding cow's milk and having a cow's milk free diet, which is will work, but is expert advice. If it's eczema, that needs its own treatment, which is subject of a separate talk. If it's bacterial infection, it needs certainly an antibiotic ointment initially, and if it becomes more widespread, can lead to a nasty infection. The child spreads it themselves from their nappy area elsewhere, called impetigo. Then they'll need antibiotics by mouth, an antibiotic syrup. And finally, seborrheic dermatitis. If diagnosed by a paediatrician or general practitioner, then hopefully they're fairly expert in skin diseases. If not, you need to see a skin specialist, and usually responds to a steroid ointment. I hope that helps with nappy rash. Thank you. Take care.